Hey guys, this is Evan from Mend Physical Therapy, and today we're going to be talking about nerve glides. I'm going to show you how to do some nerve glides in this video so that you can do them at home. And we're also going to be talking about kind of some of the science behind nerve glides and why we'd want to do them. So let's cover that first. So nerves are very interesting structures. They get tight, similar to how muscles do, but they tend to take longer to calm back down once they get tight. And now having tightness in your nerves can cause a lot of problems. It can cause your posture to be forward. It can cause you to have a forward slumped posture. It can cause numbness, tingling, and pain all along the distribution of the nerve. And then it can also cause all the muscles that surround the nerve to be tight and feel tight, like you can't quite stretch them out. So nerve glides are a really good way to calm down nerves and reduce all those symptoms we just talked about. One myth that I always like to bring up is that a pinched nerve is an unhappy nerve. If you're sitting right now, you're sitting right on your sciatic nerve. And for most of us, that's not causing any problems. They've actually done a lot of research studies where they have people who are awake and they have their back open and they're pinching and pulling on the nerves coming out of their spine. And it's not a problem at all. Nerves are designed to take a little pressure and be moved around. But when you take that same pinching of the nerve and you pour a solution that has some inflammatory chemicals on it, you get immediate pain and that whole nerve distribution lights up. So really it's more about the chemistry of what's going on and the irritability of the nerve rather than the actual pressure itself. As Adrian Lau likes to say, nerves like movement, space, and blood flow. If we can get our nerves to be well nourished and moving, they will tend to be happier. I tend to think of nerves as a representation of the nervous system as a whole. You have your fight or flight response, and you have your rest and digest response. When nerves are irritated, we're constantly in this fight or flight mode, which you can imagine long-term has some negative consequences. So that's our general rule, is that if your nervous system is in a heightened state, if you're in a lot of pain, if you have a lot of tightness, you're going to want to do a nerve glide, a flossing, rocking the baby, as I like to say. And if your nervous system is more calmed down, like in a rest and digest phase, you can stretch the nerves, you can really pull on them and get some more length and work on your posture. So check out the video. I'm going to show you the techniques and we're going to talk about how many and how often to do them. Let's start with the median nerve. To put maximum tension on the median nerve, you're going to go into shoulder abduction, you're going to go into forearm supination, elbow extension, wrist extension, and finally finger extension. To maximize it, you can go into the side bending of your neck in the opposite direction. So this is maximum tension. Of course, to relieve tension for this stretch, you can just undo any of those motions you just did. So whether that's bringing the head back to neutral, or pulling the fingers up, or bending the elbow, all of those relieve tension and can allow you to do a glide of the median nerve so that we're pulling the nerve this way and then we're pulling the nerve this way. Next, let's do the ulnar nerve. To maximally stretch the ulnar nerve, you're going to bring your arm into abduction, rotate your wrist into maximum pronation, extend the wrist, and pull the pinky and ring finger back. A nice way to do this is kind of hook it on the side of your face. And then to maximally stretch it even more, side bend away. This is going to be maximal stretch for the ulnar nerve. To cause a glide, you can undo any of those motions. So bringing the head back to neutral, or you can straighten the elbow. And so a glide from the neck to the fingers would look like this, where you're going to be putting tension down here and slack up here. And then you're going to go back and forth. So now let's go over the radial nerve. To maximally stretch the radial nerve, you're going to have your arm in internal rotation, and then you want to straighten your elbow, flex your wrist, and then close your thumb inside your hand. while keeping the wrist bent. You then bring the arm into shoulder extension back behind you and abduction, and you'll feel the stretch in the nerve. To get maximal stretch, side bend the head away. To undo maximal stretch, just undo any of those motions. Bring the head back to the middle, and a common one is to just bend the elbow back and forth. So if you wanted to do the full glide, you could stretch at the head and relax at the elbow, and then get your rhythm going like this. So the research says to perform 2 to 3 sets of at least 15 repetitions all the way up to 30. Remember, nerves want movement, space, and blood flow, and the goal of nerve glides is to calm down the nervous system. You can perform your nerve glides over as many or as few joints as you're comfortable with. And don't forget that nerves can get very irritable, so take it easy and experiment with these. Thanks for watching.